Welcome back to the American College of Surgeons Bulletin Brief from the front lines, Surgeons' Voices. With me today, it's with great pleasure that I introduce our guest, Dr. Andrea Hayes. Dr. Hayes is president of the Society of Black Academic Surgeons. She is also the surgeon-in-chief at the North Carolina Children's Hospital and a distinguished professor of surgery at the University of North Carolina School of Medicine, where she also fills the role of division chief of pediatric surgery. Welcome, Dr. Hayes.
Well, thank you very much for having me.
Pleasure to have you here with us today. You've got a lot of accomplishments, a lot of titles, very well deserved, and very uniquely positioned to understand the issues that are now so important to everybody. They've always been so important. They've come to light more recently to more people, I think, particularly diversity, equity, and inclusion. And you were really a pioneer. You are a pioneer in what you've done. So perhaps you could give us a little outline of how you established the firsts in your specialty.
Yes, well, I happen to be the first African American female pediatric surgeon that's board certified in this country, and that has been quite a journey. I trained at Dartmouth undergraduate and medical school, and then my career was really shaped by my mentor, who was at the time the chair of surgery, Claude Organ Jr., who's since passed away, but he was a phenomenal mentor and leader in academic surgery. And his leadership and guidance and sponsorship and mentorship was really what encouraged me to just keep going with my dream and really helped me enhance my career.
Dr. Organ was a wonderful man. I was fortunate enough to work with him when he was the editor-in-chief of, uh, before it was called JAMA Surgery, but it was Archives of Surgery, and he was the editor-in-chief, and he was kind enough to take me on his editorial board. He was a wonderful mentor and helped many, many careers. So you had a great role model there, but being the first is really impressive. And you're now in a role both at home in North Carolina and nationally and internationally as the president of the society, that you can help a lot of other people. So
Yes.
perhaps towards that end, how did the society start to get where it is today?
Yes, well, the Society of Black Academic Surgeons was founded in 1989. And at that time, there was less than a dozen Black academic surgeons. And actually, Dr. Organ was one of the founding members of the Society of Black Academic Surgeons. And I was an intern in 1991, and he introduced me to SBAS through an annual meeting that he was hosting at the time in Northern California. And that meeting that occurred in 1991 was my first introduction to the Society of Black Academic Surgeons. And when they originally established the society, they had hoped that the need for such a society would evaporate over time. And the purpose of the society is to really provide mentorship, sponsorship, and guidance to academic surgeons who happen to be African American and help them navigate the academic world and progression and promotion from assistant to full professor. And also to reach back in the pipeline and encourage younger folks in junior high school and high school as well to pursue medicine and to pursue surgery. And what we execute in SBAS is really mainly through our annual meeting. And during the annual meeting, we try to have as many residents, students as possible. We charge them, we charge students nothing to attend the meeting and residents a very nominal fee so that they can attend. And it's an incredible opportunity to interact with chairs of surgery, deans, division chiefs, lots of people now in these at this time in the 21st century. We have more than 11 people now. Of course, we have about 200 members, and the faculty are make themselves immediately available at the annual meeting. And prior to the COVID crisis, when we were able to have in-person meetings, we were able to really use the break time and the reception times and the times where we establish our mentorship schedule to have one-on-one interaction. It's really very valuable because as you know, as a leader, your time is valuable and it's difficult to get on the calendar of a chair or a dean or a division chief. And to have the opportunity to talk to them for several minutes one on one is very, very important for their career and really has catapulted careers in the past and will continue in the future.
Well, it sounds like SBAS has tremendously grown and is reaching down into the ranks even before medical school, which was a wonderful thing to be doing and an important thing to be doing to keep increasing um, engagement in the future. What's been the result? How many members are there now?
Well, we have a total of 250 members plus or minus, and that includes the residents and students, and of course there are members as well. And I want to just mention something about our Reach Back programs. We have our annual meetings in cities where academic institutions are hosting us. Our upcoming meeting is being hosted by Washington University in St. Louis. And what we try to do there is utilize the schools in that area who have identified their outstanding STEM students. And we have on Sunday morning a time when the STEM students can come and interact with 5 or 6 SBAS members and really get a sense for what it means to be a surgeon, what surgeons look like, and how we interact, and that we're real people that they can touch and see and interact with. And that has really been very powerful. I think those students have really gotten more excited about medicine and surgery by spending those 2 hours on a Sunday morning with us and in the very cities that we travel to for our annual meetings. So that has been really very, very rewarding. And we're always looking for more members. I don't think we have enough members from the surgical subspecialties. We want to be all inclusive of urology and cardiovascular surgery and not just general surgery. So we're right now, one of our campaigns is to diversify as far as the different types of surgeons so that we can increase our membership.
That's very important to do that, in fact, to diversify into the subspecialties. And two other questions about membership. The first is international, whether you have members from outside of North America and or any liaisons with other similar societies elsewhere in the world.
No, we don't yet have international members. We're looking forward this year to opening up our annual meeting virtually. And that we are specifically targeting the West African Surgical Congress and some of the other um, congresses outside of the United States. And we're hoping that the virtual meeting will provide an opportunity for them to interact with SBAS and hopefully apply and become members. That would be really exciting for us.
Yeah, that's excellent. I mean, certainly these virtual platforms give a wonderful opportunity for international engagement, which is important. And even the recognition of more and more people knowing your society exists is going to generate more and more interest in it. And towards that end, how about people like me? I mean, how can we help leaders in surgery who are not African American but want to promote this incredibly important need to achieve equity?
Yes, everybody can help, especially the chairs. We have several programs that occur during the year where we solicit applications from our members, and the chairs can really help promote these programs to the individuals in their department who are African American. And what we have found is that we are able to develop these really neat partnerships. The most recent one is with Cigna, uh, the insurance company Cigna, and they are providing a fellowship to one of our members that will be a year-long fellowship where they will have access to the data from Cigna to allow them to do research on access to care and equity in healthcare. And so that partnership and that ability to connect with industry essentially is really valuable. We also have partnerships with the Society of University Surgeons, with the American Surgical Association to have fellowships and visiting professorships during the year at different time points. So the chairs can really help us by identifying they're bright superstars that can participate in these programs. In addition, we're just trying to get a more robust list of folks that are excited about being active in SBAS because we often get emails. I often get emails as the president from various institutions who are looking for example, an applicant for the chair of colorectal surgery or an applicant for the chair of uh, any kind of surgical division that they have and the new positions that they have open. So we're developing a robust database so that we can have the CVs readily available and the names readily available for chairs who might be interested in having one of our members apply. So that's something that we've been doing more recently and we're excited about.
Yeah, all very, very important efforts. Certainly, the COVID-19 pandemic, although it's given us the advantage of showing our lectures around the world and having engagement around the world, is obviously the disadvantages outweigh the advantages. And one of the disadvantages is that not everybody has had the same access to care. And that
Right.
problem has been highlighted. And I've spoken with Andre Campbell and with others about some of the healthcare disparities that have really been uncovered. Do you notice as you're coming towards your annual meeting any shift in the focus of the papers submitted, looking more into that subject of some of the disparities in healthcare, which have always existed, but again, it's the realization of it and the public widespread dissemination that it's not a problem we need to just keep talking about. We need to fix it.
Right, right. We definitely have seen an increase in those manuscripts that are looking usually at the individual state and from a state perspective, the disparities that in healthcare that occur, and then of course by various specialties. And there have been some really, disturbing information that has come out regarding in pediatric patients, the access to even simple, what we call simple care like appendectomies is very, very poor and the likelihood of patients dying in the hospital is much more common in African American babies and children that are from low income neighborhoods within various states. And this has been repeated over and over the research for different states. So we've got a lot of work to do. I think we need to really, in every specialty, have better attention to access to care and what I call expedient access to care. In my field of pediatric surgery, we need to get the moms into prenatal care early. We need to get the patients into the hospital before their tumors are progressed, et cetera. So we've got a lot of work to do, but there's a lot of work being done. And as we uncover these disparities and access issues, we can target areas of our states that need help.
Yeah, I mean, there's a lot of help needed and a lot of work all of us need to do to get there. So there's the general uh, public, the population, in solving disparities. There's the issue of achieving equity in terms of the overall pool of surgeons. And then as academic leaders, department chairs, division chiefs, deans, as you say, and your society clearly is playing a very instrumental role in that regard. So where do you envision the society, let's say in 10 years? Where would you like it to be?
Well, I hope that the society in 10 years has a membership that's closer to 1,000 and maybe even 1,500, and that we're able to really penetrate every academic institution so that we aren't losing people in academia. For example, we have a large proportion of underrepresented minorities at the assistant professor level, but not so much at the full professor with tenure level or at the chair level. So I'm hoping that we can tighten up that progression so that we see more people progressing as they should. The other problem that we're hoping to begin to solve this year, that hopefully 10 years from now will not be a problem, is retention of residents and retention of fellows. It turns out that African American surgery residents are 6 times as likely to be dismissed from their residency before finishing compared to their white counterparts. That data is from the ACGME. And so, what we and SBAS have done is this year we're partnering with a business that has an anonymous app. that can be, the app can be downloaded on your cell phone, and they can immediately report any microaggressions or inequities that are occurring to them on a day-to-day basis while they're in the hospital. It's a very easy app. They can just press record and speak into it what just happened to them and how disturbed they are about that incident. And then that information goes to our senior leadership in SBAS, where we reach out to the individual if they would like us to and help them troubleshoot that incident and also provide for them tools to be successful in their residency in that environment. And we think this connection with SBAS is really going to be a huge advantage over what is already in place, which the ACGME, of course, has, where they can report these incidences directly to the ACGME. But what can happen is if there's only one African American resident in the entire residency and a racist incident gets reported, of course, that individual is going to maybe targeted. And more importantly, they want to graduate from their residency and they don't want the residency to be in trouble or on probation. So we think this way of anonymous reporting to SBAS will help these residents navigate the waters of residency and be able to get through so that we can reduce that resident, what I call the pipeline leakage, to zero.
So that's two of the three goals you've spoken about. Excuse me, having more people get into the leadership positions from associate professor to professor, and stopping the leakage in the pipeline. And then the third one, of course, is the public, patients at large. And are there currently, or do you envision public awareness campaigns, any kind of programs that will target patients in public to help the issue on that other tier?
Yes, I'm hoping in the next few years we can embark on that. Now that with the good thing about the COVID pandemic is people are very comfortable using virtual platforms, doing podcasts, and so we can branch out in that. We are currently doing a lot of podcasts for medical students and undergraduate students, but we can branch out in that and do more podcasts for the public and public information about various diseases and various surgical diseases and encouraging them to get to the doctor early, et cetera. And I think with all of our SBAS members, we have access to our communities, often through our churches, where we can get that information disseminated.
Great, thanks so much. It's really great work that you're doing, and I certainly going to do everything and encourage my colleagues to do everything to recruit members and to help support the society, because it's a very, very important cause. Any additional parting comments?
Not too much. I just want to really thank you for asking about SBAS and putting this in the limelight. We are excited about our growth and hope that people will go to our website and look us up and join members. Our members are not exclusively African American. Anybody can be a member of SBAS. And so we encourage many people to be members.
Well, I'm looking forward to hopefully being accepted as a member and to helping promote the cause, because it's a critically important cause and we need to make it happen.
Yes, definitely. Thank you very much.
Thank you very much.